Hello everyone, my name is Andres Rangel, and today I'm going to be presenting on global measles. So, what are measles? Measles are defined as a highly contagious disease caused by a virus. They are usually spread through people when an infected individual breathes, coughs, or sneezes around a non-infected individual. And effects from measles may range from severe disease complications and death in some cases. So, who does measles affect? Measles are most common in children, however, they may affect anyone, including people who are non-immune, meaning they have not been vaccinated, or they have been vaccinated but have not built up immunity. Measles is still common in parts of Africa, the Middle East, and Asia. Children affected from malnutrition or immunocompromised conditions such as HIV/AIDS may be at a higher risk for contracting measles. Additionally, countries with damaged health infrastructure or health services due to natural disaster or conflict, resulting in overcrowding residential camps, are also at a high risk for spread of measles. A little history on measles. Before the widespread introduction of measles vaccination in 1963, major epidemics occurred every 2 to 3 years, causing an estimated 2.6 million deaths a year, according to the World Health Organization. Uh, After accelerated immunization by countries, WHO and the Measles and Rubella Partnership, as well as other international efforts, have successfully prevented 56 million deaths between 2000 and 2021. Looking at the prevalence of measles across the world, prevalence referring to the number of existing cases, we can see that prevalence measles cases globally have decreased by 75% from 36 billion reported cases in 2000 to only about 9 million cases in 2022. The prevalence of measles mortality rate globally decreased as well by 82% from 772,000 deaths in 2000 to about 136,000 deaths in 2022. Most recently, there has been an estimated 9 million reported cases of measles, but only about 136,000 deaths globally in 2022. This is an 80% increase in reported cases from 7.8 million in 2021, and a 43% increase in reported deaths from 95,000 in 2021. Looking at specific prevalence rates for measles in specific continents globally, as of 2022, we can see that African continents reported an estimated 97,000 cases. America is about 47 cases collectively. Eastern Mediterranean about 56,000 cases. And in European continents about 825 cases, as well as 49,000 cases in Southeast Asia continents, and about 1,400 cases in Western Pacific continents. Similarly, looking at incidence of measles across the world, meaning the number of new cases, and the incidence of measles rates globally from 2000 to 2016 have declined by about 85%, from 853,000 cases to about 132,000 cases, which is an average 88% decrease in incidence, from 145 cases to about 18 cases per 1 million people. In 2019, the incidence of measles increased 5 times compared to the 2016 incidence rate, with a reported 837,000 cases, which is 120 cases per 1 million people. In 2022, these incidence rates of measles increased about 71%, from 17 to 29 per 1 million people. And incidence rates across different continents reported per 1 million people in 2022. They found that in African continents it was about 81.6, while in the Americas it was less than 1%. In Eastern Mediterranean, it was about 82.4 per 1 million people, and in the European continents, it was about 1.1 per 1 million people. In Southeast Asian continents, it was about 23.8, and in the Western Pacific continent, it was about 0.8. Next, looking at the impact of globalization on the spread of measles, we can see that globalization is a consistent factor in the spread of measles internationally, as this occurs in many ways, including global tourism, global trade, and migration of people from one country to another. In fact, according to a study in 2020, they found that despite the U.S. declaring to be measles-free in 2000, the U.S. reported more than 100 measles outbreaks, over 2,000 reported cases, and 3 deaths, which were all related to infections in travelers entering the country. More significantly, here in the U.S., an outbreak in Disneyland in December of 2014, which began with an 11-year-old unvaccinated California resident, visited a theme park and spread infection to about 8 different people. The CDC later found that 125 measles cases were attributed to this one outbreak across 7 U.S. states. However, the Public Health Agency of Canada did report that a single imported case from the U.S. Disneyland outbreak was the source of a larger outbreak of over 150 measles cases in Canada. Looking forward at the methods for controlling global measles outbreaks, we can see that the most effective method for controlling measles outbreaks on a global level, according to the World Organization, is community-wide vaccination due to it being inexpensive and safe. Specifically, children are the main target population for vaccination against measles, which only requires 2 doses. The first dose, usually given at 9 months of age in countries where measles is common, or about 12 to 15 months of age in other countries where it's not as common. The second dose is usually given later in childhood, between 15 and 18 months. And research also suggests that key public health activities can prevent outbreaks, such as enhanced public health surveillance of measles outbreaks that are reliable and efficient. Additionally, assembling outbreak response committees was also another effective method of controlling measles outbreaks, and they found that improving patient education on measles transmission and collection of data on measles outbreaks were also useful in helping to prevent them. Lastly, identifying local communities with geographical and socio-cultural features that are consistent with low vaccination rates, or communities with a greater chance of transmission, were also a key focus on preventing outbreaks, as these were used to model better plans for reducing measles outbreaks. Looking at the effects of global measles on economic development, we can say that the effects of global immunization against measles on economic development and productivity of many lower and middle income countries has an indirect relationship, but is a significant impact on the overall economic development of these countries. In fact, according to the CDC in 2023, they found that in lower income countries, such as Ethiopia, on average a household can lose 1 month's income to care for a child sick with measles, which has repercussions not only for the individuals but the economy of the country if measles outbreaks continue to be common among lower income countries. Furthermore, the economic cost of measles outbreaks can be expensive, with one measles outbreak response in Ethiopia costing an estimated $758,000, or more than $70 a case, which is significant since 2 vaccines needed to prevent the disease outbreak is less than $2 per child. Thus, measles affects economic productivity and development in low-income countries, as well as reducing the availability of resources of healthcare systems in these countries. Lastly, when we look at the influence of socio-cultural practices on global measles, socio-cultural factors can play a major role in the rate of global vaccination distribution, especially among lower-income countries that may have significant socio-cultural barriers to measles vaccines. Factors can include religious beliefs, vaccine-seeking behaviors, wealth distribution, community influence, educational level, and social roles based on gender or custom, for example, marriage. In fact, according to a study that looked at sociocultural factors, influence on the incomplete vaccine distributions in Amak sub-county in Lea district in northern Uganda, they found that wealth was a significant sociocultural barrier to measles immunization due to the inability to access healthcare facilities due to transportation barriers. Similarly, unmarried women were less likely to take their children to complete their immunization due to low health education or awareness, and this came from fear to meet nurses due to social stigma of not being married and feeling shame from older married women in their communities. And community-oriented interventions that are centered towards local beliefs and social practices could be more effective at measles vaccination distribution by including local community leaders and health educators on spreading awareness and changing social stigmas in their communities. These are my references. Thank you for watching.